Hi, everyone. I'm Dr. Maggie Ney. I co-direct the women's clinic here at the Akasha Center. I'm a naturopathic doctor. I have been at Akasha since 2006. It's wild. So that means I think 19 years this summer. So amazing. And I love it. And I'm still grateful to come here every day. I love the work I get to do. And I love working with women. And I've always been interested in women's health, but my passion towards perimenopause in particular and supporting women in midlife has really, I got really focused on it more because of the patients that were coming into my office. So I would see women, across their lifespan, but I had a lot of women in their 30s and 40s coming in and literally just crying, crying because they had no idea what was going on with themselves, feeling unvalidated by their other healthcare practitioners, really not knowing what was going on with their bodies. And that not knowing and not feeling like yourself is really scary. And it's really common during this perimenopause window. But I think one of the reasons that make it so hard, part of it is really just not knowing. Because when you feel like your body's changing and you don't know why, and you don't know if this is just the new normal, it's really scary. And that fear can almost make symptoms worse. So I love having opportunities to get to speak to people and speak to women and men and really educate about this time of your life because it really can be such an incredible period. I feel like this is such an opportunity where we can make some changes and really set ourselves up to live the best life, the life of our dreams. This is our time, but we do need to take care of our bodies and really have our hormones working for us rather than the other way around. We want to use all our resources and we really can set ourselves up to thrive. So let's talk a little bit about perimenopause. I want to let everyone to know that this talk is being recorded. There's a chat box. If you want to open it, you can just say hey or ask any questions. I'll be kind of keep an eye on that. And I'm going to talk for a bit and then we'll have lots of time for Q&A. So we'll get everyone's questions answered. So let's talk a little bit about perimenopause and hormones. So hormones are involved in every single metabolic reaction in the body. We have hormone receptors from our head to our toes, every organ system. So when they start to behave differently, when they start to fluctuate more erratically, which happens in perimenopause, and I'll really go into the perimenopause definition in a moment, but when our hormones start to behave differently, we feel it. Of course, we feel it. We have these receptors throughout our entire body. And what brings most women into my office is how they feel mentally. So both women feel like their brains aren't working the same as it used to. So, being able to remember, so brain fog, being able to remember things. I'm sure I have notes here because I'm going to try to stay on target, but being able to remember names or being more forgetful when you're not as efficient at work, that is really terrifying. And a lot of women come in because they feel like their brains aren't working the same. And another common reason that brings women in is because their mood changes, which is another really common symptom of perimenopause. And that's because we have hormone receptors throughout our brain. So when they are not being fed hormones in the way they're used to, we feel it both cognitively and emotionally. So let's go into some definitions so we can really make sure that we're all on the same page. So let's start with menopause. So menopause technically is the 1 year anniversary since your last period. So it's truly based upon your period. So I see sometimes a lot of women coming in and they say their doctor tells them they're in menopause because their FSH is high and their estrogen is low. So they're in menopause. But that is really not the definition of menopause. So you really need to go that full year without your period. And then that 1 year anniversary since your last menstrual period, that's menopause. So it really technically menopause is 1 day. And then everything after is kind of considered post-menopause. I prefer the term menopausal years because you're really never done with menopause. And that's another thing I hear a lot about is women saying, I'm done with menopause. Well, not really. Maybe your symptoms are better, but you're still, if not making hormones. So you're still in that state of menopause. And then here is it's not a new term, but it's definitely getting more recognized and I'm super grateful, but this idea of perimenopause. And before I talk about perimenopause, there is one thing I want to say about menopause because I was mentioning how really it's based on your period. That is not the best it is how we define menopause, but it's not great, and it can be really confusing for a lot of women if you've had a hysterectomy, if you've had your uterus removed, you're not getting your period anymore, but if you still have your ovaries, you're still making hormones, so you don't have that barometer of your menstrual period. And then if a woman's having an IUD, like a progestin IUD, like a Mirena IUD, a lot of women don't bleed anymore. So it's hard to know if you're in menopause or not. So it's not a perfect definition. And I just want to like put that out there. But perimenopause is this whole time frame that leads up to menopause. It's not like it starts at age 40 or 38, but it can start in our mid 30s. I think like the CDC or professional organizations say the average age is 47, but I definitely see it starting earlier. And women can report symptoms of perimenopause starting in their mid 30s, certainly through their 40s. And you're basically perimenopausal until you go that 1 year without your period. Okay, so and then premenopause is like everything before perimenopause. Perimenopause is a clinical diagnosis. So what does that mean? That means your symptoms alone can help diagnose you. So there are a lot of symptoms, and we're going to go through that list together because I do want you to hear all the symptoms that have been associated with perimenopause. But your symptoms alone, so there's no blood test that can diagnose this because during perimenopause, our hormones fluctuate a lot. So, and it's that fluctuation that really categorizes, like really highlights what perimenopause is. It's not so much taking a blood test and seeing, what your estrogen levels are, your FSH levels are. It's because our hormones during that time just fluctuate. So there could be a moment where you do look perimenopausal or menopausal. And there could be times when your hormones are totally normal. So a lot of times women come in saying their doctor tells them they're not in perimenopause because their labs are normal, but that's absolutely not the case. So labs are important because it can rule out the many other possible causes for your symptoms, like thyroid or anemia or vitamin D deficiency, right? Like if you can correct all those and you're still having these symptoms, and you can be fairly certain that if you're in your 30s or 40s and you're experiencing these symptoms that I will go through, that you are in perimenopause. So let's talk about the unique needs of perimenopausal women. So perimenopausal, we said that they start in like around mid 30s, 40s. So this is a time when our hormones do start to fluctuate more erratically. So during the premenopause year, so when we're in our 20s, maybe early 30s, there's a regular rhythm and flow to our hormones. We have estrogen that slowly like increases in the first half of our cycle that triggers our brain to ovulate, tell our brain to send out the hormone to cause our ovaries to ovulate. Then we ovulate, and then we make progesterone. So there is a normal rhythm and flow of hormones throughout our menstrual cycle. But what happens during perimenopause is estrogen starts to be produced more erratically. And it's not so much how much hormones we have at a particular time, like I was telling you, it's more about how they fluctuate. And estrogen, the ups and downs of estrogen can make us feel like we're PMSing like all the time. And then overall progesterone, which is a hormone that we normally release after we ovulate. So during like a regular normal cycle, we produce progesterone from ovulation to when we get our period. We tend to not produce it as robustly, so progesterone levels can start to decline. And sometimes during perimenopause, we may bleed and not ovulate, so we don't have any progesterone being produced. So we have these erratic hormone level production that can lead to a whole host of symptoms. And this is happening, and I just want to say these are unique needs of us perimenopausal women. These hormonal changes are also happening at a time where we might have like peak craziness of our life. Like we could be at the peak of our career. We can be really, a lot of us are parents, moms, taking care of children. For many of us, it's like the sandwich generation where we're taking care of our kids, but also our relationships with our parents are changing and we're taking more on the caretaker role, which can be very stressful. We can have more relationship challenges. So all of this life is happening at the same time our hormones are fluctuating. So it truly can be this perfect storm between hormones and life that can be making our symptoms even more profound. And sometimes what a lot of women say to me when they come see me is like, I don't know what's going on. Like, I don't know what it is. Is it like my husband or is it my hormones? Like, I don't know what's causing me to be so pissed off. So And sometimes it's all of it because it can truly be a perfect storm. But let's go through some of the symptoms, and I have them listed, and I'm going to read most of them because they're really important, and they can be really surprising. But here are the most common symptoms. So some of the earliest symptoms of perimenopause are your period starting to change. So sometimes it's very subtle. So unless you're tracking your cycle, you might miss it. But normally, if you're like a 28-day girl getting your period, you might notice your period coming every 27 or 26 days. So sometimes subtle. You could have a change in bleeding pattern. So it could be a lot heavier or more clottier. And then mood changes are another big one. So more irritability, depression, anxiety, sleep issues. So all of a sudden you used to be a great sleeper and now you're waking up at night or you're having difficulty falling asleep. That's really common. And then later on in the perimenopausal journey, you can start to have more of the hot flashes and night sweats, but some women get them early on too. And one thing that's common that's not often talked about is getting these hot flashes and night sweats right before your period or right around ovulation. That can start to happen during perimenopause too and be new. So you could still bleed for another like 10 years after those symptoms start, but you can be more susceptible to them. But let's talk about some of the other symptoms. So period changes, mood changes are the big ones, but feeling less resilient kind of goes with the mood, but things that you used to be able to handle with ease, all of a sudden can just feel a little too much, too overwhelming. Heavier menstrual cycle, we talked about irregular menstrual cycle, more tender breasts, headaches, fatigue, brain fog is a big one. So lack of focus. A lot of women feel like they have ADD or having early dementia. I hear that all the time. Reduced libido, more anxiety. We talked about weight changes, worsening PMS, hot flashes, dry skin, changes in body odor, bloating, insomnia. We spoke about night sweats, vaginal dryness, also very common, more burping, more GI issues like constipation, worsening allergies, ringing in the ears, painful intercourse, hair thinning, hair loss, more facial hair, heart palpitations. That's a big one. That Oprah Winfrey kind of brought that to center stage because she was having a lot of palpitations during her perimenopause and she was seeing like a million cardiologists. And you can imagine like she has like access to the best healthcare and it was missed for Oprah, the heart palpitations, because all of her tests were normal and no one put the link towards perimenopause. More achy joints, joint pain, frozen shoulders, really something that happens more commonly during the menopause transition, during perimenopause, more frequent urinary tract infections, not recovering well after exercise, having like itchy crawly things, like feeling like things are itching, crawling on your skin. Some women have more electric shock sensations in their skin and then feeling more dizziness. So there are a lot of symptoms. Some of them can be very alarming, like you want to see a specialist, and many women do. And it can be important to get like the full evaluation. But at the end of the day, a lot of women are told there's nothing wrong, your labs are fine. Many women are told, welcome to aging, which is like my pet peeve. Get used to it. And it's absolutely not correct. We can truly thrive during this time. So I feel like at this point, we kind of get an understanding that perimenopause is this time where our hormones start to fluctuate more irregularly. And I want everyone to know that once we kind of understand that, I want everyone to know that there are tools we have to help ourselves feel better. So we're going to go through that. I will say that when I talk about hormones fluctuating, that can cause a lot of symptoms that I spoke about, but also lifestyle stress, worse, our hormones are even more susceptible to stressors. So our hormones can fluctuate and that could lead to, irritability, anxiety, and sleep issues, the hormones alone. But also during this time, our hormones are like exquisitely sensitive to our lifestyle, meaning if we don't sleep as well, or we don't eat as well, or we're under a lot of stress, it can more easily throw off our hormones. So it's like this cycle. So really, this is why how we take care of ourselves and our lifestyle becomes even more important, right? Like I'm sure we can all remember that there was a time in our life where we could stay up all night, drink a ton of alcohol, eat a whole pan of pizza, and like wake up and be like, all right, let's go to our 8 a.m. class. Like that just simply is not realistic anymore. Like we really do need to pay more attention to our lifestyle. So my approach and what I want to teach you guys today is to really thrive through perimenopause. It's looking at the lifestyle, and we'll go into that. It's targeted supplements and even hormone therapy. When we combine those, and it can evolve throughout your perimenopause journey, but when we can understand all these resources and tools and know when to use what, we can absolutely thrive during this time. So Let's start with some of the lifestyle principles. So let's start with nutrition. So a lot of us are wondering like what to eat, what to eat, what to eat. I highlight that what to eat is important, and we'll touch upon that. But also when we eat and how we eat is also really important. Nutrition and nervous system regulation is really important to highlight, to focus on during perimenopause. So, as far as how we eat, I do like to mention this. I mention this to like most of my patients, and it does resonate. We need to be eating slowly and mindfully. We really should not be multitasking when we eat. And this recommendation can be harder than like popping a supplement or taking a medication. But a lot of us do have more GI issues during the menopausal transition. And instead of like jumping to like a lot of tests, invasive testing and restrictive diets, sometimes just being mindful of just eating slowly, eating mindfully, chew your food well, and don't multitask. Like turn off the TV, put away your phone, even put away your book, and just you and your food and look at the presentation, appreciate the smell. Our digestion begins before food hits our mouth when we get in this state. It activates that parasympathetic nervous system, which already activates our digestive juices. So eating slowly, eating mindfully is really important. What we eat, we really want to focus on nutrient dense whole foods, and the goal during this time is we want to get adequate protein. I know that's a hot topic right now, and the reason why it is for women is that when we go through the menopause transition, we lose muscle mass more quickly. It's a process called sarcopenia. And the reason why many of us end up in like nursing homes when we're older is not because we're sick, but it's because we lost so much muscle that we lack mobility and to safely like get out of bed, be able to get dressed, to get off the toilet. So if we want to prevent that from happening, focusing on our muscles during this period, our perimenopausal period, is super important. So lifting weights, which we'll talk about, is very important, and then getting adequate protein. So how much protein should we get? Well, there's a lot of different theories, and I think we're having definitely a protein moment in our time. But generally, like if you can aim to get like 25 to 35 grams with a meal, that's great. Some people say you should get a gram of protein per ideal pound of body weight. That definitely pushes it up a little bit more. I think just being cognizant, being mindful that you're getting protein with every meal and aiming for like 25 to 35 grams in a meal is ideal. You want to make sure we're getting enough fiber because a lot of us are not getting fiber, and that fiber helps with blood sugar stability. It helps us feel full. It helps feed the microbes of our gut, which are all very important for hormone and hormone metabolization. So we want to aim to get like 25 to 35 grams of fiber daily. Um, and Yeah, so the blood sugar stability, the protein, and then the fiber and metabolic flexibility. Metabolic flexibility is an ideal state we want to be when we're going through perimenopause. And that's the state where we can easily switch from burning sugar for fuel, which is glucose, to burning fat for fuel. So if anyone ever feels like dizzy or lightheaded if they haven't eaten, sometimes that can be that we're not metabolically flexible. So again, eating real whole foods, lots of dark leafy greens, healthy sources of protein, fat, and fiber can help us become metabolically flexible. And then the when we eat is the idea of like intermittent fasting. And I think for most people, like having like a 12-hour window can be like a very healthy way where we can activate a lot of metabolic processes when we go through that 12-hour fasting period. So that's kind of the summary of the nutrition piece. Um, Hydration, so many people don't drink enough water. So like during perimenopause, we can have more like brain fog, difficulty focusing. And if we're not drinking, we're not helping that situation. And I want to give like really easy to use, like simple strategies that can actually have profound differences. And waking up in the morning, having 16 ounces of water before your coffee, before your tea can have a profound difference. So that's what I recommend. Wake up, have 16 ounces of water. Then if you want your coffee or tea, that's fine. Or another 16 ounces and drink that throughout the day. A lot of people come back reporting more energy and more ability to focus. And so I definitely recommend that as far as one of our lifestyle. Sleep is key, and sleep can be compromised during perimenopause. It's one of the most common symptoms during perimenopause. Whether it's night sweats waking us up or our active mind, which can happen more during this time, like we can ruminate more. And part of that is again like everything we're dealing with, but also the hormonal changes. Progesterone in particular is a very calming hormone and can help us sleep. And as that is lowered or non-existent for a cycle, that can absolutely contribute to poor sleep and sleep disruption. We want to make sure we're getting our movement in, and there's 4 things we want to be careful and really cognizant of during perimenopause. It's 4 different types of exercise. We need the cardio, we need the weights, we need stretching, and we need balance exercises. So think about that when you're making your exercise routine. We don't need to just do cardio. We talked about the importance of lifting weights and really making sure we're using all major muscle groups, like at least twice a week, and lifting heavy. So we're preventing muscle loss. Stretching is key to prevent injuries, super important. And then balance is also really important because our balance is affected as we get older. We can be more susceptible to falls, and even just practicing the proprioception exercise balance poses can be really important as we're like setting up a program to really age optimally. The other things that are just really important during this time that come up a lot with my patients is like our community, our friendships, mindfulness. So being aware, are you aware when you feel stressed or overwhelmed? Like, are you aware of that? And then do we have tools to help lower that? So mindfulness is really important. Checking in with our bodies. What do we need in this moment to feel whole and complete? And doing that without judgment. Because as we go through perimenopause, our nervous system can become more dysregulated. What does that mean? That means we can feel more easily stressed, more easily overwhelmed. And a lot of us are just so used to going, and we just forget that we need to slow down, check in, and see what our body needs. But having the stress awareness and then tools that you use. So journaling is really an incredible tool. Breath work, emotional freedom technique, which is tapping. These are all things you maybe just jot down and you can like dig into, or we can talk more about it during the Q&A. But having these tools to help lower stress and regulate our nervous system is a really powerful tool for getting through the perimenopause journey. And then always joy. Like we have to prioritize joy. Can't tell you how many times I've talked to women, what brings you joy? And that is a trigger for tears because we've lost that. So that's just another thing that I always want to prioritize during this time. Okay, let's talk about certain supplements that I think are very foundational for women who are going through perimenopause. So the lifestyle piece, that is like we never reach the end. Like we're always going to be on a journey to modify, tweak, and bring in more of the lifestyle pieces. So I want everyone to kind of just be cognizant of all those things I talked about and work them in. And then for supplements, I think magnesium, particularly magnesium glycinate, is a really great supplement for many women who are going through perimenopause. Magnesium is a cofactor in like 400 plus reactions in the body. It's important. It can help us calm our mind and our bodies to get ready for bed. It's good for our muscles. It's good for hormone metabolization, detoxification. So I really like magnesium glycinate for most women, before bed. I think a nice B complex, again, these B vitamins, just like magnesium, are cofactors in a lot of reactions. So just to have that extra support, like neurotransmitter production, we need the Bs and magnesium. So just to have that as a foundational support during this time can be really powerful. Many women and men do need a vitamin D3 product because we tend to be low, and that helps with like energy and mood. And we know it's protective against heart disease and cancer. So vitamin D is good. I definitely recommend having that level check and make sure it's, in the optimal range. An omega-3 fatty acid, another really great foundational product that's good for heart health. It's anti-inflammatory. And then 2 specific ones for perimenopause that is getting a little bit more talk that I like. One is collagen. Again, it's like good for hair, skin, and nails, which can be affected as estrogen levels decline, or elastin and collagen production declines. So we're more prone to those fine lines and wrinkles. So collagen is an easy addition. Creatine is another one that helps build muscle. So I like that as well. And then these are kind of the foundational ones. I also like anything to support mitochondria, which are the energy powerhouses of cells that make, ATP, cellular energy. Those are like foundational supplements that I think a lot of women do well on when they pair it with, all the lifestyle pieces. There are specific herbs and others that can be helpful specifically for hormones, which if you're curious about, maybe just we can talk about it in the Q&A, but those are really foundational, easy to find products that, again, combining with the lifestyle can be really profound. And then for the last few minutes of this talk, I do want to talk about hormone therapy, because this is something that there's a lot of misinformation about it. I know I practice in LA and I can't, and a lot of my patients, they like have seen so many doctors and are given just absolutely like the wrong information about hormones. So many women are told they can't start hormone therapy until they're done, until they, are in their post-menopause. And that's absolutely not correct. So hormone therapy is actually giving your body back the hormones that are fluctuating more erratically or that we're losing during the perimenopause process. So we can actually give you back a little bit of estradiol, bioidentical, so the same molecular structure as our own estrogen. We can give you back a little estradiol. We can give you the progesterone and sometimes even testosterone. And basically, like, because as I was mentioning, our estrogen levels fluctuate so erratically during this time, and it's that fluctuation that can lead to a lot of symptoms. So giving your body back like a very low dose estrogen, it like fills that tank, that if you think of it like a gas tank, so that if your estrogen drops low, like you have a little in there to help stabilize you. And if you, during perimenopause, you can have periods where your estrogen naturally is very high, like it just is that fluctuation, but giving your body back just these low levels of hormones, it fills the tank. So if it goes high, it doesn't push you too high. And if it goes low, you have some hormones in there. And so this can be a really powerful tool during perimenopause. So like if you're having night sweats, hot flashes, we think estrogen. I mean, there's studies to show that when a mood disorder happens during perimenopause, this is studies just done for women in perimenopause. It hasn't been replicated for postmenopause, but actually hormone therapy can be as effective as an antidepressant. So that the Menopause Society has even documented in their literature. But what's happened so often is a lot of women experience depression, anxiety, sometimes for the first time during perimenopause. And what are they given? They're given often like an SSRI. And if that's the appropriate choice, amazing. But like you should still have this conversation, right? Like the link should be made that perhaps the hormones are playing a role and that this is also an option. So the FDA approved indications for using hormone therapies are hot flashes and night sweats, vaginal dryness, osteopenia, which is a little loss of bone mineral density, which you only get from getting a bone density scan, and then premature or early menopause, which I didn't talk about in the definition, but that's if you go through menopause like before age 45, that's early, and premature is before age 40. So if that ever happens, like you really do need to be on hormone therapy. So mood is not one of like the FDA approved indications for hormone therapy, but we use off-label use of medications all the time. In fact, when a lot of women present with hot flashes and night sweats, the most common recommendation is an SSRI. So that's like an antidepressant, even though that's an off-label use. But the idea of using hormones to address some of the mood disorders of perimenopause is sometimes looked upon frowningly, but I'm telling you, off-label use of medication is done all the time. So I can go and talk about hormones for a really long time. I guess I just want to say there's a lot of misinformation. When you're working with someone who's trained in the hormones, it can be a real game changer for women when it's also combined with all the lifestyle and the supplements and really kind of set you up to thrive. Because I do feel like this is our time to be really clear on like the vision of the life we want to lead. What is it? How do we want to live our life? What do we want out of this life? Like I encourage people to have fun and visualize the future they want to live. And when you can start to feel so good, through all these different ways that I talked about, you can truly like feel epic and really get after all the things in life that light you up. So I hope that was helpful. Now we have time for Q&A. And I see one in the chat. I'm going to just read it. I recently had a large stress in my life that will be present for a while. Since that has happened, I have been getting night sweats. Can stress bring on some symptoms of perimenopause? Yes. So our hormones become more sensitive to stressors, right? So if you're under a lot of stress, then it can throw off our hormones more. So yes, absolutely. I mean, I've had people who've had such extreme stressors, it kind of put them into menopause. I mean, it stopped their period. So yeah, I mean, that's why looking at this through like an integrative holistic lens is really important. Now, we can give you things to help like reduce those night sweats, but yes, the stress could be the trigger. And that's another thing I talk about, like perimenopause is not necessarily this, like it can last 10 years, but it's not like you're going to be symptomatic for 10 years necessarily. Like a lot of times symptoms come and go, and the trigger for the coming part is like a stressor. So it's a time to like step back, reevaluate, think about what's going on in your life. I know it's like a crazy time for many of us, like that sandwich generation, the taking care of so many people or the work stress can make this experience more difficult. But being aware of that and knowledgeable is helpful and I think very empowering. What is your approach in determining the best delivery of hormone therapy? So, well, yes, there's a lot of approaches and options. So, estrogen, you have a lot of choices. So, the FDA approved estradiol options, which is a bioidentical, FDA commercially available estradiol, can come in many forms. It can come in a patch, a gel, a spray, and a ring, and a pill. So you have choices. I and many, many other practitioners generally will say, let's start with the transdermal. It is a little safer. Not that oral is like super high risk, but oral estrogen does increase your risk of getting blood clots a little bit, like less than birth control pills, which we know is handed out so easily, less than being pregnant. But it does slightly increase your risk of getting a blood clot, whereas a transdermal does not. And because you can be on hormones, literally, you could start in your 40s or 50s and be on them to the day you die. Even the most conservative medical organizations say there is no more a time limit to how long you can be on hormones. Our risk of getting a stroke does increase, as we get older anyway. So, like, if we can start with transdermal, that is usually what I recommend. The patch is the one that's like often covered by insurance. A lot of women love the patch because you can just put it on and like leave it on and change it twice a week. So those are the commercially available estradiol options. And then, some people want to go through a compounding pharmacy if you're curious about that, but that can come in all different sorts of ways, from creams to trokes and a lot of different options. I do think if you are working with someone, like, they should present all options for you. They shouldn't skip the FDA approved, commercially available, like the stuff you can get at CVS or Rite Aid. They should present all options. They shouldn't just go straight to compounding. You should know that you have because the often these hormones can be covered by insurance and they're bioidentical. They're good. Okay, so that's estrogen. Progesterone. Um, Oral micronized progesterone, or also known as permetrium, is a bioidentical progesterone that is given orally. So if you have a uterus and you're on estrogen, you do need to take progesterone. A progestogen is like an umbrella term that includes progestins and progesterone. So the bioidentical, which you were asking about, is the oral micronized progesterone, and you want to take that orally. Most people love their progesterone. It's like they describe it as like having a warm, cozy blanket that they can just like go to bed and like feel warm and cozy and sleep really well. It's like kind of works as a sleeping pill for some people. They love it so much, and it can reduce anxiety. Some people don't notice any changes when they take progesterone, but they actually like have to be on it because you have a uterus, right? So if you take on estrogen, you have to be on a progesterone to protect that uterus. And there's a smaller percentage of women that actually are sensitive to progesterone. They don't feel good on it. That's not common, but if that's the case, then we talk about other ways so you can still get the uterine protection. And then testosterone is another hormone that I give through transdermally. It's the safest way to do it. There's no FDA approved testosterone option for women currently, which is unfortunate. I don't know if it's ever going to be in our lifetime just because of everything that needs to go into getting FDA approval. But so the options for that is either I will prescribe a man's testosterone and women just use 1/10 of the dose, or I will use a compounding pharmacy and get it compounded into a cream with the right dose for that woman. So those are the delivery options. I hope that helped you. Oh, I have another question from Susie. Okay, for the supplements, do you have a recommendation for those foundational ones, what to look for? Well, I know Akasha Naturals, we have them, and I think we can send a link for we have the magnesium glycinate, we have a methylated B, we have a really good omega-3 that I love. But for those Bs, B12, omegas, you can really find them most places like Air One, Whole Foods. I mean, they're pretty, and the D3. We like D3 paired with K because, and so more and more Ds you'll see are paired with K too, it helps because it helps facilitate calcium to be absorbed. And then the K helps guide that calcium to the bones, which is where we want it, and not like the arteries of the heart where we don't want it. So we'd like to pair the D3 with K2, which we have at Akasha. And again, you can find it over the counter. And then collagen, there's like we don't, I think at this time have it at Akasha, but there's a lot of like over the counter options, and same with creatine. I mean, Thorne makes one, but there's a lot of brands, so I don't even know. I mean, I can talk separately about getting you guided to a particular one. But I do think it's good to look at the ingredients and look at the inactive list. Like if you look at Centrum multivitamin, not to put it down, 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 but like the inactive ingredients is so long. Like we don't need that. So it is nice to get in the habit when you're looking at a supplement to look at the what's in it, and then to look at the inactive ingredients. There should be no red dye or blue lake or any of that. It's unnecessary, and that usually says something. So just look, it should have minimal inactive ingredients. So another question is, how long would perimenopause last? And postmenopause on average, how long to keep experiencing symptoms? Okay, great question. It's interesting. The SWAN study is like one of the amazing studies that it's currently being done. It's measuring. It's like one of the studies that looked at different ethnicities of women going through menopause, because so often it's just done on like white women. So we know for like it's different. And it's different for everyone. Like, I mean, some women literally have like no symptoms. Many women will have it, I think for like white women, it's like 7 years on average. We know Asian women on average have it for like 4 years, and then Black women tend to have it for like 10 years. Now, it's different. It's different. But so, it can last up to 10 years. And if the average age of menopause, I should let everyone to know, is around like 52, but anything like above 45 is still considered normal. So you can literally subtract 10 from like so at 42, is a totally appropriate time when a lot of women might start to have some symptoms, or in the late 30s. So, and then yeah, so that's a great question about like how long are these symptoms going to last for? Well, like I said, I have very little tolerance to like dealing with symptoms. So please know there is a lot of treatment options. Like I had like 2 hot flashes and I'm like put that patch right on. Like I'm like I didn't want to deal with it. But okay, but the mood changes that are so common during menopause, like the depression, the anxiety, the brain fog, do tend to get better 2 years after your last menstrual period. And same with night sweats and hot flashes, they typically get better. I mean, that's a long time. I know, I mean, I think of struggling for like 2 years after your last period, but typically symptoms do get better on their own after at that point. But having like when I said earlier, like you're never done, it's like low hormones. We know that that can have an effect on our heart and our brains and our bones. So we have to focus on that piece too, because even if your symptoms are better and your brain is working again, and you're not getting night sweats, like the lack of estrogen certainly has its toll. Like the number one killer of women is heart disease, and part of that is facilitated by part of that is the hormone piece. So you still want to be mindful of other things that can be happening behind the scenes, even if your symptoms are better. And like studies do show that women's quality of life like increases so much as they get older too. Like we're happier, the studies show, like as we get older, which is great. Like we're happy with we don't where our tolerance to BS is down, we're comfortable saying no, we know who we are, like we are happier. But like if you're struggling with symptoms, that pulls us back. This is why I'm like, let's take advantage of like being where we are in our life and the confidence we build and all the experiences to make us who we are, and let's also feel like amazing. I think I digressed. But let me
I have a question, Dr. Ney,
yes.
it's from Jenna.
Yeah.
Can menopause affect sexual health, and how can women address these changes?
Oh my gosh. Yes. Such a yes, yes. In many different ways. So one is a lot of women experience changes in their vaginal tissue, like vaginal dryness. So sex can become more painful. That can absolutely be addressed. Like vaginal estrogen is like so helpful for that. I feel like it's not offered enough to women, but so that can affect sexual health. And then lower hormones, estrogen and testosterone, can affect libido for sure. It's big. I mean, I feel like men Well, a lot of men are just like addressed so easily for like erectile dysfunction, and they're given Viagra so easily. And like the discussion to like how their partners are and if their partners want it or if their partners are even able is not had. So I feel really passionate about the sexual health piece. There's actually two FDA approved medications to treat low libido in perimenopause that are very underutilized. One is a medication called Addyi, and it's safe and you can take it at night, and it's FDA approved to treat low libido perimenopause. But like, who's heard of that? But Viagra, they had a really good marketing campaign. I mean, it used to be called impotent. And like the Viagra people came around and they're like, it's called ED, and we're gonna get that man in a suit and he's like sexy and he has ED, right? And like, I don't know. Anyway, I obviously can talk about that for a long time. But yes, menopause can affect sexual health. There are therapeutic options. Pelvic floor PT can be helpful, especially if there's been pain and like muscle tension. The vaginal estrogen, vaginal DHEA, there's like an FDA approved, it's called Intrarosa. That works really great. And then libido side. And libido is not just like necessarily low hormones that go into libido, but it's everything, right? Like it's the hormones, it's our stress, it's how we feel about our partner. So there's a lot of variables. But the other thing I want to say about libido is because it's so common. It's so common that like I'm surprised when someone's like, I have a good libido. Like I hear low libido all the time. The one thing that I'd like to educate people on, just to be aware of in case this helps, is that spontaneous desire does change, and that is normal. Spontaneous desire is like you wanting to like rip your partner's clothes off, like in the elevator, like that burning desire, like that does go away, and that's normal. But a lot of women, because they don't have that or they used to have it, think something's wrong with them. But there's nothing wrong. That happens to both men and women. What's important is if like once you're having responsive desire, meaning once you're in the act of being intimate, that you actually do enjoy it. So some people get so caught up on that like spontaneous desire not being there that they think something's wrong with them, but that's can be normal. And when we normalize that and we focus more on like feeling the way you feel after that closeness or during, then that's okay. So I just like to normalize that piece, and that sometimes helps people. Someone asked, what brand of
Yes.
creatine do you, what?
I was saying yes. I missed that question. Thank you.
Okay, yeah. What brand of creatine do you suggest? Well, there's a few, but I like Thorne. Thorne makes a good one. Can you be prescribed progesterone only? Yes. And no estradiol, or does this depend on the individual? Oh, totally. It's individualized, but yeah, a lot of times during perimenopause, I do stagger hormones in. I rarely like introduce like all of them at once. But progesterone is often, sometimes I'll just use that during perimenopause when they're like having more ruminating thoughts and insomnia, or sometimes spotting in between periods. We'll start with some progesterone for sure. And sometimes I'll use progesterone and testosterone. Like there's different combinations based on your symptoms and how you're responding.
Karen
Um,
asking about iron.
yeah, is testing high in iron concerning or also normal? Well, I wouldn't say it's normal, but like, and it's not necessarily concerning. Depends how high. You want to make sure, medically you don't have like an iron storage issue, which is there's something called hemochromatosis. So like if I see someone with like a lot of high iron, I'd want to rule that out. Sometimes cooking with a cast iron pan can cause high iron. So just a lot of people are doing that. So you just want to be aware of that. And then like taking a look at like other markers like percent saturation and ferritin levels just to compare it. So no, it's not normal for perimenopause. I don't know how long it's been going on for you. Like sometimes I'll see it, I'll recheck it, it's normal. If it's like chronically high for a very long time, for over a period of time, and I don't know why, and you're not taking it, sometimes look at your supplements. There's surprisingly sometimes iron thrown into things. Maybe just see like a hematologist to try to understand why, but it's nothing terribly concerning. Um, the reason why it ever is like we don't have a way to we don't have a way to lose iron. So a lot of us are like anemic, or many women have low irons because they're bleeding every month. So once that is less frequent, you're not shedding your blood, you can have more iron build up. But yeah, anyway, I would have it just checked out, but it's not like terribly concerning. And just yeah, have a look at the ferritin, the percent saturation as well. Any other questions?
Yes.
Yes.
What are some natural or alternative treatments for menopause symptoms?
Well, there's a lot of herbs and, I like maca a lot. It's an adrenal adaptogen. It can help with certain menopausal symptoms, so I might use that. And there's like a lot of other herbs that I might use to see if it brings some symptomatic relief. So like there's red clover or dong quai or chase tree berry or black cohosh. So it is sort of like trying a product and see how you work. I didn't really talk about this, but you do want to just make sure everything else is like good in your health. Like if you have GI issues, you definitely want to like make sure that's been looked at. Heavy metals, you want to make sure like that's not going on because when you address like the other aspects of your health, it can help improve your overall health, which can help make the perimenopause journey a lot easier.
And what are the most effective treatments for managing hot flashes?
Estrogen.
Okay. Thank you.
There's a few FDA approved treatments for vasomotor symptoms. One is a form of paroxetine, which is like Paxil, but a lower dose of it, which is a type of SSRI. And there's Fizoa, which is a new one. Stops the hot flashes and night sweats. It's pretty good at that. It doesn't do the other benefits of estrogen, like our bone health, our heart health, our brain health. But those are other like FDA approved. And then again, like a whole host of supplements. We Akasha has a product called, and I'm just hoping I have the name right because I know the ingredients, but Estro Balance, I believe, if I have the name wrong, but we can put the link there. That also helps a lot of women because it addresses some of it has like the B's and the magnesium and or nutrients to help support estrogen metabolization. So that's another option as far as like a natural product. But I guess you didn't say natural, I did. So you said in alternative. I will
Alternative.
say, just because we have a minute, I'm a naturopathic doctor, but some people will come see me like, well, I want to approach this naturally without any meds, without any hormones, because this is what our body's supposed to go through. But I challenge everyone to be like, what is natural anyway? Like, we used to die in our 50s and 60s. So our life expectancy is so much longer. And our hormones are just so important to like feeling good mentally and physically, and like to expect to have the same level of energy and vitality and productiveness without hormones is just not realistic for most of us. So like is it normal and natural for us to live to like 90 and 100 now? Glasses, are they natural? But like, of course, we're going to use them to see. So it's like challenging our mind, our worldview, our thought pattern over like what's natural, what's not natural, and the choices we make. It's like, how do you want to live? It also, I think we used to like slow down when we were, in our 50s or 60s, but like I don't want to slow down, ever. So I want to keep hiking and traveling. And like for many of us, we still need the hormones to be able to do that. I think
You
there's
meant fem balance.
fem balance, yes, yes.
Okay, cool.
There's a few more. Can you be on in perimenopause even if you have a high follicle count? Sure. Yeah. Do you have treatments effective for lichen sclerosis that can spike? I don't think I understand the question. Do you have treatments effective for lichen sclerosis? Usually, topical corticosteroids or, sometimes topical estrogen can be helpful, but I don't know what that spike during periods. I mean, it's always good. Yeah, I don't quite know what if you want to. Am I answering your question right? Like usually, if like you see you do. I like women to see a specialist because, but like usually like either a topical corticosteroid and vaginal estrogen can be helpful for that. And yeah, it's more likely I see it in I can see it more often in perimenopausal menopausal women. Any other questions?
I do have a few from info, a few more for you from info. I think you kind of addressed this, what lifestyle changes can help alleviate menopause symptoms?
Yeah, kind of everything I said from
Yeah.
nutrition to movement, mindfulness. Like I feel like our nervous system, I mentioned it earlier, becomes more dysregulated, right? So what does that mean? Like we're more prone to like feeling more stressed or anxious, and like anything that we've suppressed kind of in that subconsciousness of ours, like more easily gets aroused during this time. So it's an incredible opportunity, to look at that mindfulness piece, to making sure we're living our life in alignment with our like purpose, that we're living true to ourselves. Because we can't deny it any longer. Like I think so. I think that's really important. Like we really don't have much tolerance towards things we don't want to do anymore. So it's like I said, it's a gift. But I think a lot of times, if we're not in tune to that part of us, it can creep up and aggravate how we feel emotionally. But yeah, so taking care of our mental health, sleep is so important. Morning sunlight is so important. Like when we talked about how important sleep is and prioritizing, like really protecting your sleep at night is so important. Try to get that 7 to 9 hours of sleep every night and having a good evening routine where you're dividing your day into night and doing something calming, and again setting up that nervous system to be able to fall asleep, to stay asleep. Keep the phone out of the bedroom is really important. So many of people are like doom scrolling at night. It's just not good for our brain, like dopamine and our sleep hormones get disrupted. So keeping the phone out of the bedroom, and then morning sunlight is important. Like if you can remember, we had that 16 ounces of water before your coffee, and then getting outside and getting some morning sunlight. That morning light, if you have it like without sunglasses, getting outside within the first 60 to 90 minutes of waking really helps to kickstart our circadian rhythm today and our cortisol rhythm during the day. So it's like these simple things that can have really profound differences. We're more prone to being more insulin resistant, more inflamed, having more blood sugar dysregulation. So really, like again, lifestyle wise, focusing on that, on eating real whole foods, getting enough protein, fat, fiber, dark leafy greens are also important.
What role do regular checkups play during perimenopause and menopause?
Well, they're very, very important, but not everyone is trained in this, and that you could be seeing like the best doctor, ever, so well intentioned, so smart, but they may not be the best match for supporting you through perimenopause and menopause, because this is not something doctors are trained in school. There's been numerous reports, like studies like that they get like 1 to 2 hours during medical school, less than like 3 hours during residency to support women through this time. So you want to make sure you're seeing someone who is trained and specializes in perimenopause and menopause. So it's not just anybody, it's not just any OB. If you really, because it's not like really taught, the doctors who specialize in this had to go out of their way to be educated in this piece in a woman's life. But they're very important. You do want to check up at least every year, but like more if you're having symptoms. But we're also like more prone to like, heart disease and other health, the chronic diseases tend to pop up at this time. So you definitely want to see your doctor, because like cholesterol can increase and blood sugar can increase, all of which doesn't have to, but those don't always lead to symptoms. So you want to get your yearly blood work done.
So if a patient is having chronic cholesterol issues and the doctor isn't doing anything for them, should they then seek bioidentical hormones for this, or I
I mean, it
mean,
just depends. I mean, I don't, you're saying cholesterol?
yes.
Well, it depends how high it
Mhm.
is. And I think getting, a coronary calcium score, so you're looking at the arteries around the heart, are very important. I've seen hormone therapy reduce cholesterol and LDL and triglycerides. It depends how high, your family history, what your coronary calcium score is, all of that.
Okay.
Yeah, there's a lot of different treatment options for, elevated cholesterol, and hormones like a piece of it that should be part of the dialogue.
I have a few more questions, and I'm just going to go down the list that I've obtained here. What are the risks and benefits of using hormone therapy for menopause?
Well, the risks are, it's very safe. Like the idea is you want to use it early in the menopause transition. So we recommend using it within the first 10 years.
Mhm.
When you use it past that 10-year mark, which doesn't, it's not really relevant for like perimenopausal women, but like for menopause, that past that 10-year mark, the benefits for like cardio protection and brain are not as strong. And I think if you go like in the 15-20 year post menopause, there is a slightly higher risk of getting a clot within the first 6 months of starting hormone therapy. But that's like if you have been without hormones for a very, very long time and then added in. And then it's just like, that's why the discussion is a little different if you're coming from that stand. If you had a breast, I should say, like there's always been this concern that hormones cause breast cancer, but that has been absolutely not valid. It's from the Women's Health Initiative study that's been debunked. So we know that hormones do not cause breast cancer, but if you had a breast tumor in you already that was grew in the presence of estrogen, it could stimulate it to grow a little faster. But even from all the studies, like no one who took hormones died more or died faster. It was like anything, it was maybe help them get diagnosed and treated quicker. But so the risk isn't the risk, I guess, to just be flat out is like if you had a breast cancer that was, it could maybe stimulate it to grow a little faster. If you take oral estrogen, that does slightly increase your risk of developing a blood clot, and it can slightly potentially that's because it has to be metabolized through the liver and it increases clotting proteins. If you've ever had a stroke that's been or a blood clot, I should say, that wasn't triggered by something like a surgery or a plane ride or being bedbound, and you just like that's called an unprovoked clot, then hormone therapy is not recommended. A lot of times it's like a little bit of during perimenopause with hormone therapy, a little bit of trial and error in a very safe way. Like, how does your body respond? Like, nothing is like permanent. Anything can be shifted and stopped, and see how your body responds.
Okay, and then our last question for the evening, if nobody else has any. Can starting treatment for perimenopause early make a significant difference in managing symptoms and long-term health outcomes?
I mean, yes, but it's individualized, you know? It's not like I think for some women it can be a major game changer. But I don't want to say it's like this magic potion that everyone, if they took it, is gonna like have the best life ever. Although I'm a big supporter of it. Mostly I'm big into educating because there's so much misinformation and fear, and then you can make the best choice. It's very safe when used like at the right time and the right formulation. We know that from the Women's Health Initiative, so from studies, we know that women who use it have higher quality of life, tend to live 3 years longer. I mean, hello, that's pretty good. It tends to prevent heart disease. So there is a lot of benefits. I know for a lot of my patients, it's been transformative and life-changing. For others, we need to do there's something else going on. And that's why individualized medicine and just working with someone who gets to know you and can look at all the variables that can affect your health are really important.
Thank you, everybody. If there's
You.
no other questions, thank you, Dr. Ney. Thank you,
Thanks,
everybody who's
everybody.
joined. We
Follow me at
appreciate it.
HelloPeri, the HelloPeri if you're not already, because I have lots of good hormone stuff there. So grateful. Thanks for
Thank you,
coming.
everyone.